Now, one might wonder, well, what do we do? What do we do to have resilience? What do we do with dealing with outages? Now, in South Africa, we all know that the power situation at the moment is not ideal. There are the dangers that the grid will fail. There is extended power outages, and yes, hospitals have generators, but those also have not got a finite amount of time that they can run. So what do we do? Well, I can tell you in the United States, an interesting thing that hospitals have done to deal with this is to write down on a whiteboard at least what their patients, who their patients are, what their medication is, when they last had medications and allergies. Just specifically when dealing with a cyber attack, this information is useful for those that are working with patients. Now, ransomware was said to kill a patient in Germany. Now, the short version of this is a patient got deferred to another hospital due to the systems being offline during a ransomware attack. My question is, should we not be able to offer a minimum amount of patient care, even when all our technology or power systems are off? The best way that you can be resilient is to have a backup plan, to have a minimum patient care that you can achieve without the use of technology or power. Now, yes, this means that a lot of diagnostic things cannot be done, but surely there should be a minimum amount of patient care that can take place. Now, collaboration between medical and technology personnel is super important, as well as up the food chain. There should be transparent conversations about what has happened. Now, during incident response, one of the things that is often forgotten is lessons learned, where we sit around a table and we unpack what has happened, what we've learned, and what we can do better. But due to the fact that psychological safety is not always there post-incident, it is important that this conversation is one that is, non-accusatory and a learning activity. Now, how do you defend against ransomware? Well, it's not that easy. You can have all the blinky lights and all the tools, but immutable copies and a recovery plan that allows you to recover fast is critical. I have a saying that says prevention is unattainable. Early detection is key.